All right, so for my machine check today, coming into the room, I'm going to double check that I do have an auxiliary oxygen tank. Looks like I have one here and a couple over here. And I'm just going to go ahead and check and make sure I have a tank hooked up in the back and go ahead and open that. And I'm just double checking that I'm connected to the oxygen at the wall. I'm going to flip on my machine. While that's starting up, I'm going to go ahead and disconnect it from the wall just to make sure that I do have an auxiliary battery and that it's functioning, and then I can plug it back in. While I'm up here, I'm going to make sure that I have an ambu bag and it's functioning. I'm going to check my monitors. I've got a blood pressure cuff, I've got a pulse ox, I've got telemetry leads, and I've got my end-tidal CO2 already connected to the circuit. I'm also going to check my suction, make sure it turns on and is nice and strong, and that's looking good. While this is all getting started up, I'm going to go ahead and check my vaporizers. It looks like they're both filled and they're both closed. If they weren't, I top those off. While I'm here, I'm going to check the Link 25 system, turn on the nitrous, and just make sure that the oxygen comes on with it, indicating that I can't get a hypoxic mixture. So going back to the alarms, I'm going to make sure that my alarms are on. Nobody's turned them off. If I wanted, I could go ahead and set my tidal volume, rate, and all the settings for my patient that's coming up next. While I'm right here, I'm going to double check, make sure I have at least 50 psi from the wall for oxygen, and that my oxygen tank in the back has at least 1,000 psi in it. It looks like it does, so I'll go ahead and close that tank just so I don't have any leakage. Alright, so first off, I'm going to go ahead and calibrate my oxygen sensor. Go ahead and open that to air. Going into my settings here, I'll set it to calibrate and calibrate to 21%. While that's calibrating, I'm going to come down here and check my scavenging system. I have a little bubble here. It should be in the green zone. It's attached to suction, so if it was below or above, I would either turn up or turn down the suction until it was where it needed to be. I'm also going to check my scavenging system, my CO2 absorbers. Make sure that they are in place, they didn't get dropped down, that they're not exhausted and don't need to be replaced. It looks like my O2 calibration was successful, so I'll go ahead and close that. Go back to settings. I'm going to do my low pressure test. So I'll occlude and compress the balloon, make sure it stays for 10 seconds. Once it has, I'll go ahead and connect that, flip this down, and again, I will occlude it and make sure that it stays deflated for 10 seconds. Once it's passed, I'll go ahead and flip this back up, put that bulb away, and next I'm going to do my high pressure test. So I'll disconnect the circuit, and again, occlude it down here. I'm going to close my APL valve and inflate until I have 30 centimeters of water or pressure. And I'll just ensure that it stays inflated at 30 for 10 seconds, indicating that there's not a leak in the high pressure system. So once that 10 seconds is over, I'll reopen that APL valve so it's ready for the next patient. I'm going to test my artificial lung. Alright, so I'm going to connect that to the lung. I'm going to switch it over to vent, and if need be, I'd fill the bellows for this test. I'm going to be watching these little valves to make sure that they flutter with inhalation and exhalation, and also that the vent is actually administering the volumes that I have set. Alright, so once I've confirmed that, I go ahead, switch it back to APL, make sure the valve is open, and reconnect the circuit, and I would document all of this according to the facility's protocol. Alright, so this is Mrs. Handelin is coming in for surgery today. She's a 73-year-old. She's 5'4", 62 kilograms, a BMI of 24. She has no known drug allergies. Her only medication is Zoloft. She has an anxiety disorder. So she fell at home, injured her right shoulder, so she's coming in for a right shoulder arthroscopy. She may or may not have gotten an interscaling block in pre-op. We'll just assume that she did. So for equipment here, I'm going to use a 6.5 ET tube for her. I have a 6 and a 7 ET tube up here in case I needed them. I have a Miller 2 and a Mac 3 blade and the handle, a 10cc syringe. I have a towel laid out here to set my OPA or any dirty instruments that I think I'm going to need to use again. I have my nerve stimulator for train of 4. I have 3 OPAs, an 80, 90, and 100 millimeter. She got 2 grams of Ansef in pre-op, and because she was quite anxious, I gave her just 1 milligram of Versed due to her age. I didn't want to do 2. So for induction, I'm gonna give her 50 mics of fentanyl. She's gonna get 60 milligrams of lidocaine, so about 1 milligram per kilogram. She's gonna get 85 milligrams of propofol. A younger person of her size would get more like 124, but I'm gonna decrease that by about 30%. However, I do have more available if she needs it. After induction, I'm gonna give her 6 milligrams of dexamethasone. For paralytics, I'm gonna give her rocuronium, and she's gonna get 35 milligrams. And about 30 minutes before the end of the case, I'm gonna give her 4 milligrams of Zofran. I do have some emergency drugs. I've got ephedrine and phenylephrine and succinylcholine in case I needed it. And for reversal, I'll use the Gamadex, but I'm gonna hold off on drawing that up until I know what she's gonna need. So I've got gloves on, I've got mask on. We're following all the usual precautions. So when she comes in, we're gonna have her scoot over in the bed. All right, Miss Handelin, I'm gonna give you a mask here with some oxygen. And I'm gonna have you breathe on that, okay? So I'm gonna give her 100% FiO2 and set it at 6 liters. I'll go ahead and hook these up. If you need to adjust this mask, go ahead and do that. So I'll make sure I have a good seal, and I've already got the end title hooked up. I'm gonna hook up my other monitors. So I've got my pulse ox here. I'll put that on this right arm. She's got an 18 gauge IV in this arm. I'm gonna go ahead and put a blood pressure cuff on the other side. Mrs. Handelin, I'm gonna put some little stickers on you here for a heart monitor. I'm just gonna reach under your shirt. I'll get my telemetry on. So I'm gonna be looking with that good seal. I should have an end tidal CO2 and end tidal oxygen. I'm gonna be pre-oxygenating her for about 3 to 5 minutes until that end tidal oxygen is greater than 90%. All right, so I'm gonna double check my monitors here, make sure everything is coming up, and it looks like it is, and I'm not missing anything. Mrs. Handelin, I'm gonna have you tip your head back a little bit as far as is comfortable, so I'll have her put herself in as much of a sniffing position as she can. And I confirmed that my APL valve was open. All right, so assuming that 3 to 5 minutes has gone by, I'm gonna just go ahead and lay a towel out here on her chest. And I'm gonna start with some fentanyl, so get an alcohol prep. Mrs. Handelin, I'm gonna hook up your IV here. Clean that. And I'm just gonna give her those 50 mics of fentanyl. You're gonna start getting a little bit sleepy here, okay? And I throw that in my sharps area out here. Next, I'm gonna give her the 60 milligrams of lidocaine. And again, put it in the sharps. And I'd follow that up with the propofol. And again, that's 85 milligrams. And I'll push that in. It's gonna take her about 30 seconds to a minute to be sleepy enough with the propofol. So I'm gonna go ahead and give her that 6 milligrams of dexamethasone while I'm waiting. I'll give that nice and slow just so she doesn't get any disconcerting side effects. All right. So once that's in, again, I'd sharps that as well. I'm gonna come over here. Mrs. Handelin, how are you doing? I don't get any response, so I'm just gonna do a lash test, and I don't have any response with that either. All right. So I'm gonna go ahead and tape her eyes here. And I'm just gonna confirm that I can ventilate her. So I'll close that APL valve just a little bit and give her a little breath. Let's just say I got a little bit of resistance. I'll go ahead and put in an OPA. I think we'll go with this 90 millimeter. Looks like a good size for her. Go ahead and slide that in and just confirm that I can ventilate easily. Beautiful. If I were not able to ventilate, I would go ahead and RSI her. But since she's ventilating just fine, we'll continue with the original induction plan. All right, so now that I've confirmed I can ventilate, go ahead, strap this on. And I'm gonna give that 35 milligrams of rocuronium. Put that in, and I'll just have my circulator be sure to be available to help hand me the ET tube and all of that. So I've got a second towel laid out here in case I need to set anything on it. I've got my 10cc syringe. I can assist her ventilations if needed. And I'm gonna start with a Miller tube blade. So I'll set that right up here in my clean zone. So I'm going to turn down my fresh gas flows, take the mask off, and slip this OPA out. So I'll just take a look here. And surprisingly, I have a Cormac grade 4, so I don't think we're going to go with this. Do you mind getting the glide scope? So I'll go ahead, stick this here, pass this in the dirty bin, and I'm going to resume ventilating her. Alright, so if it was going to take a while to get the glide scope in here, I could turn on some SIVO like at 3% just to keep her sedated. However, it looks like we have it right here. So if you don't mind switching out the stylet on that for me as well. So I've got my glide scope right here. Again, I'll just keep masking her in the meantime. Alright, so again, I can turn my fresh gas flows down. I'll slip that OPA out. And scissor motion. A beautiful view of the cords. Alright, do you mind pulling the stylet? Alright, perfect. I'm visualizing the tube passing the cords. And if you don't mind just taking that glide scope out for me, I'm going to go ahead and inflate the cuff. Alright, setting that over. I'm going to connect my circuit. I'm going to give a breath here. I'm just looking for misting in the tube, and I'm watching for my end-tidal CO2 to pop up. Next, I'm going to listen for breath sounds. Again, watching my end-tidal CO2. And I have positive breath sounds as well. So since I know my tube is in place, I will go ahead and tape it. Got that taped down. And let me see, I'm going to switch it over to the vent. Let me just look at the vents. Toss those in the trash. Alright, so vent setting wise, I make sure that she has her, let's see here. And she's 24 of the teeth, so I'll document that as well. So I've got her taped. I've got a tidal volume of 450. I've got a rate of 12. We'll start her out at that and adjust as needed. So I'm going to turn on my SIVO. I'll start her at 2% and titrate from there. For someone her age, that's a little over 1 Mac. So we'll just titrate that as indicated. And we'll just move into the maintenance stage. So her case is going to take about 1.5 to 3 hours. Estimated blood loss is 50 to 100 mLs. She's going to be in a beach chair position, which is why we went with an ET tube, not an LMA. Two of the big risks with that is a CVA and venous air embolism. And again, especially with her age, she's at high risk to become hypotensive when I sit her up and move her over. So in anticipation of that, I do have some phenylephrine over here. I could anticipate giving her boluses of starting with like 50 mics at a time. I might need to start an infusion, in which case I would start at 40 micrograms a minute of phenylephrine and titrate up accordingly. She's also at risk of hypothermia, so I'll make sure she has whatever warmer we use, a bear hug or whatever, before we start, like get her started in the case. So assuming we're nearing the end of the case, about 30 minutes out, I'll go ahead and give her that 4 milligrams of Zofran. So again, clean the hub and administer that, and throw it in my sharps. So now that we're getting ready for extubation, she doesn't have anything precluding her from a deep extubation, so when they let me know that it's okay, they're done with the case, and I can reverse my paralytics, I go ahead and do a train of 4. So, come over here. It looks like I have 2 twitches, 2 out of 4 on the train of 4. So I'm going to reverse her with Sigamadex. The recommended dose for that is 2 milligrams per kilogram, so that'd be 124 milligrams for her. So I go ahead and draw that up over here. So that's about 1.5 ml or 1.25 mils. So I'll pitch that in the sharps and I'll go ahead and give it. So she's still on the vent at this point. I'm going to start watching for her to be taking breaths against the vent. And I'm ensuring that my APL valve is open, so when I'm ready to switch her back over to spontaneous, she's able to easily ventilate. So had she still been more paralyzed, been a shorter case than anticipated, let's say I didn't get any twitches on that train of 4 and I had just 1 or 2 post-tetanic count twitches, I would give her 4 milligrams per kilogram of Sigamadex. And had this been an airway emergency, right after induction, I would have given her 16 milligrams per kilogram. So reversal is going to take about 1.5 minutes, so I'll go ahead and untape her eyes, take that off, and I can discard that in the trash. I'll just start watching her. So what I'm looking for is spontaneous breaths. I see that she's starting to have multiple spontaneous breaths, so I'll switch her back over and start watching her tidal volumes. I'm looking for tidal volumes of at least 5 milliliters per kilogram, which is about 310 milliliters for her. I would also recheck that train of 4 just to make sure she's completely reversed. And I now get 4 out of 4, and she has a train of 4 ratio of less than 0.9. I'm also watching her oxygen saturation, and she's satting fine, like 98% on her own. I'm watching her end tidal CO2, it's less than 45, and she's maintaining it below that level just on her own with her own spontaneous ventilations. So at this point, I don't want her to get too awake, so I still have her SIVO running at 2% and her fresh gas flows at 2 liters. So I'm going to go ahead and just suction her, and just to make sure she doesn't cough and she's not overly stimulated by that. That would indicate that she's starting to wake up a little too much for that deep extubation. I don't get any response, so I'm going to go ahead and set this over here, and I'm going to grab my mask and my 10 cc syringe. I'm going to untape the tube. Discard that. I'm going to deflate the cuff, and again I just suctioned her airway, so I should have any saliva or mucus or anything out of there. So I'm going to deflate the cuff all the way, and again my SIVO is off. I turn off my fresh gas flow. It was running at 2 liters at this point, and I'm going to give just a little bit of a breath and pull it out. When I deflated that cuff, if she had coughed, that would indicate that she was starting to wake up a little bit, and I would not be able to continue with my deep extubation at that time. But fortunately she did not. So at this point, I'll turn my fresh gas flows up to 6 liters a minute, 100% FiO2, let her start breathing that off. If she was a little less stimulated without that ET tube in there, I might need to put in an OPA again and assist her with ventilations. But she seems to be doing just fine. So again, making sure my APL valve is open and just letting her breathe this off. She should start waking up some more, following some commands, and at that point we could get ready to go to PACU. So throughout this, we've maintained just aseptic technique. So we've had mask on, gloves on, and we've just ensured that we haven't gotten any blood or saliva on any of these areas. At this point, since I'm not going to need my OPA, I can roll up my little cloth here and set the handle up here for cleaning. And there we go.